Good morning, everyone. I'm Muriel Bowser. I am joined today by members of my cabinet, and we are here to provide the district's update on our response to COVID-19 in our city. And as I've said before, we want any interventions that we make to be targeted and based on our data. And in addition to the interventions we're going to talk about today, we also need people to understand that right now, that staying home and limiting your contact with other people, in addition to wearing a mask and practicing good hand hygiene, will help stop the spread of COVID in our city. Today, we will be making some adjustments to phase two, and we hope to help and guide Washingtonians to limit their exposure so that we can get the virus under control in our city until we get to the other side where the vaccine will be widely available. I also want to remind everyone that we have instituted changes to, or we've added more opportunities for testing to our very robust system of testing that we stood up for the last several months. Nationals Park will be open now beginning at 2:30 p.m. and it will be open 5 days a week. The hours of our other sites are also expanding, so please look at the website for those additional times. And we encourage everyone to pre-register online, which will prevent you from having to do it while you're standing in the line. We also are asking all of our residents to provide your insurance information at the testing location. You will not be asked to provide a copay, but providing that information allows us to make sure your insurance company is paying for your test, and that very needed resources for testing that we can apply in other places. So please bring your insurance card or pre-register when you come. We also continue to urge everyone to check in with your own doctor before going to a pre-testing site. Your doctors are providing tests, and you may be able to schedule it and make an appointment, and you could avoid having to stand in line. So call your doctor, apply your insurance card to your registration, and check on the sites across the city. The testing sites will not be available, our testing sites will not be available on Thanksgiving Day. And as always, we're asking people to think ahead for our meal sites. The meal sites also will not be available on Thanksgiving Day. On Wednesday, we will have 20 sites open, and you can pick up 5 meal kits at that time. Each kit has 1 breakfast and 1 lunch, and the 20 sites will be posted on coronavirus.dc.gov. The sites will be closed on Thursday and on Friday and resume normal operations on Monday. We, of course, want to reiterate that all Washingtonians are strongly encouraged not to travel for Thanksgiving and to celebrate the holiday at home with your household. For those who are traveling, please follow the travel advisory. And as of this morning, only one state is not considered high risk for travel, and that is Hawaii. Again, though, remember there are limitations to testing, and it does not replace the need to take other precautions. So please refer to the guidance, and also I'll make sure my staff post a very helpful, I think, scenario as it relates to travel and having dinner with your family. In further, if you do have anyone in your home, we recommend that you wear a mask, social distance, and again, practice good hand hygiene. And remember that outdoors is better than indoors, and avoid physical contact when greeting people and saying hello and goodbye. And do not sit people from other households together. You can find the travel advisory in Thanksgiving guidance at coronavirus.dc.gov. We know that we're making a lot of sacrifices for this holiday season, and it is necessary. This morning, we announced 139 new cases of COVID in our community, and sadly, two Washingtonians who succumbed to the virus. Our daily case rate is 23.9 cases per 100,000 people, and our transmission rate is 1.2. Like most of the country, we are concerned about the level of spread, and we have consistently been conservative in our approach to reopening. And because of that, we watched as others rolled back closer to where we've been. In other words, we have not opened our economy up at a phase 3 level throughout our response, and certainly not at a phase 4 level. And we slowly turned on allowable activities in phase 2. Today, we'll be rolling back several phase 2 activities, and we want to discuss those with you today. We're ready after very good analysis of our data and high-risk activity in our city, prepared to make those adjustments in hopes that they will blunt the curve as we go into the winter. The phase 2 adjustments will go into effect on Wednesday, November the 5th. And then again, as I just mentioned, these changes are meant to flatten the curve, help us reserve hospital beds for the most in need of care, and keep our community safe during this nationwide surge. At this time, all non-essential, non-retail businesses are strongly encouraged to have employees telework. So non-essential, non-retail businesses are encouraged to have their employees telework. We're also updating our gathering guidance and reducing the level permitted for any outdoor gathering from 50 to 25 people. Again, we emphasize that being outdoors is better than indoors, but the virus can still spread outdoors. Worship services are exempt to this specific rule because they have their own rule. Indoor gatherings are now limited to 10 people. This applies to indoor gatherings at people's homes, as well as indoor gatherings that are not subject to other rules. While restaurants, let me speak to restaurants. Restaurants may continue to open until midnight, but they must suspend alcohol sales, service, and consumption by 10 p.m. Additionally, beginning Monday, December 14th, we are reducing indoor restaurant capacity by half to 25%. We also continue to encourage our houses of worship to host virtual services, but we are reducing the maximum capacity inside our houses of worship from 100 people to 50 people, or 50% of the max is being reduced to 25% of the capacity, whichever number is lower, 50 people or 25% of the capacity. And we are also making some changes to gyms and what is allowed for gyms, private trainers, and other businesses and recreation centers must suspend all indoor group exercise classes, and any outdoor exercise activity must be limited to 25 or fewer people. Additionally, we will provide in a forthcoming mayor's order and guidance um, an advisory around sports and high contact sports in the district. So that advisory is forthcoming. Finally, we are suspending our live entertainment pilot. Entities previously granted a waiver for live entertainment will be contacted about their ability to proceed with acts or performances that have already been booked. So we'll take questions about updates to that activity. But I also wanted to mention how we will continue to support our small and local businesses and ask DC residents to do the same. Obviously, many businesses and thus their employees are making sacrifices as part of our efforts to limit the spread of the virus. And many businesses are going above and beyond to keep Washingtonians safe and employed and modify their operations, pivot their services, and offer delivery and curbside pickup. So I'm asking you to make every effort to support them in this holiday season. Today, we are launching a website that will help connect you to local businesses. You can go to shopinthedistrict.com to learn more about products and services offered through local businesses. For food and drinks, you can also go to dc.gov.com, dc.gov.com, which is a locally based online ordering and delivery platform. And of course, it's not just our residents that I've asked to shop local. We're doing the same in DC government. As you know, each year my administration releases a green book. It's a small business enterprise opportunity guide, which is designed to help local businesses navigate procurement opportunities in DC government. And so today we released the 2020 Green Book, and it can be found at greenbook.dc.com. And I'm pleased that our Director of Small and Local Businesses, Director Christy Whitfield, has joined us today. Each year I set a big goal, and in fiscal 20, we surpassed that goal. We promised to spend $910 million with local businesses, and very significantly, we spent $976 million with our small and local businesses, so just shy of $1 billion. So in fiscal 21, we've committed to at least spending $917 million with local businesses. So again, you can find the Green Book and learn more about district spending at greenbook.dc.com. So with that, we are pleased to answer your questions. I'm joined by Director LaQuandra Nesbitt, Director Chris Rodriguez, Deputy Mayor John Falchicchio, Director Chris Geldhart, and Director Christy Whitfield. So with that, I'll answer your questions. Yes. Yes.
So on the, if you could clarify on the restaurants, when does that take effect? Does everything take effect on Wednesday except the restaurant capacity? Can you clarify that?
That's correct. So the restaurant, the hours limitation and the alcohol sales limitation, I should say, goes into effect this Wednesday. The capacity limitation will go into effect on December 14th.
So why the difference there? Why wait until December 14th to limit the indoor capacity on restaurants?
We want to give the restaurant operators some ability to adjust their operations. Yes.
I really appreciate you saying that this is based on data and analysis and that these are targeted restrictions. And I was hoping you could tell us, or maybe Dr. Nesbitt could tell us more about that data. What is it that led you to conclude, for example, that serving alcohol is more dangerous after 10 p.m. than before 10 p.m. and that 25% indoor capacity is better than 50%. Can you tell us more about this data?
Well, we can tell you that we have been able to conduct a number of enforcement activities throughout our response for limited business operations, and we see less compliance with the rules later into the evening.
Thank you.
Yes.
Why not issue a stay-at-home order if the daily case rate is as bad as it was when we were effectively in shutdown? And do you ever anticipate having to do that, to go to reissue a stay-at-home order?
I don't know. I don't know, but I also don't know how effective it is for one jurisdiction to have a stay-at-home order when the entire country is open. So I wouldn't want to suggest to somebody that that is what will keep us safe without a national mandate to do the same.
And a quick follow on dining. What would have to happen for indoor dining to close altogether? And like, is there a metric you're thinking about?
We're focused, and I hope what I've shared with you is that there's a lot of high-risk activity. And so we want people to think about any of the opportunities that they have to reduce that behavior. And we've started, we've talked about a number of those activities in previous meetings and in this order. And so what we know is that DC Health has reported travel and work and social gathering and restaurants as all being of our major contributors, and those are addressed here. Yes.
It sounds like, obviously you guys have been hammering this point, but it's people behavior and activity that is causing what we're seeing in terms of increases. I know you guys are putting a lot of money into DC businesses, but how is this not punishing these businesses for people's behavior? And, again, how do you enforce this with behavior if you're not citing individuals and only focusing on businesses?
Well, we're focusing on everybody. I'm not really sure how to answer that question. We have a virus that's spreading in our city and in our country, and we're focused on all of the behaviors. A business doesn't exist without people and without their customers. So I don't know how you can say you focus on their behavior and not. I don't really know how that makes sense, but we need everybody to do the right thing.
But the question is, how is this not punishing businesses? Because there are restrictions in place, but there's no enforcement on the individual. It's just strictly on businesses and what they're doing.
I think I've answered your question. We're telling our residents that they should limit their activities, and we're telling businesses to limit opportunities for residents in some activities. Yes.
Dr. Nestor, you talked in the past about a committee that will be formed or that is working now in terms of when the vaccines come into play. And that looks like that's going to take place in December. Could you please re-educate me in terms of the name of that committee, and what is it about the committee that affects in terms of the vaccines coming to the district?
Sure. I want to make sure I'm understanding your question, and then I can speak directly to a second part of it that I think is going to be helpful for the public. We established a couple of months ago a scientific advisory committee to advise the director of the Department of DC Health on effective strategies to communicate what we believe to be complex public health information about the COVID-19 vaccines that would assist us in the equitable distribution of a safe and effective COVID-19 vaccine. This scientific advisory committee that is composed of scientists, clinicians, pharmacists, is not responsible for the development of the district's COVID-19 vaccine plan. That responsibility sits in the district's emergency operations center that the mayor established back in February, within the operations sections, health and medical branch. And that has a COVID-19 vaccine group. And we have a number of coalitions and key partner organizations. It's a public and private engagement. Our hospitals, our healthcare partners, community partners are involved in that. The Scientific Advisory Committee's responsibility is ensuring that we have an effective approach to addressing any concerns or issues that the public has, especially our priority populations, being those who have been disproportionately impacted by COVID-19, racial and ethnic minority groups in particular in the district, African Americans and Latino populations, understand the process by which the vaccines were developed, the safety and efficacy of the vaccines as they are being released, so that we can properly address any concerns that they have and ensure that they get the vaccine, because that's really what's going to help us move through this pandemic and decrease the likelihood that we will have to continue to implement some of these strategies that the mayor is discussing today, and get us into what we believe is the phase 4, which is an existence in our community similar to our pre-COVID-19 state.
So in other words, this is for Mayor Bowser. Has your administration been talking, and I know it's early, but have you all been talking about a PSA, possibly a public service announcement, particularly for people in the city who are not crazy about vaccines, and why it's important for them to get the vaccine?
Yeah, go ahead, Dr. Nesbitt.
Sure, and we've actually done some polling to be able to understand where the concerns are, if there are any in our community, why people have concerns, if they have to do with, I just don't like vaccines at all. It has nothing to do with COVID-19. If I'm concerned about the COVID-19 vaccine, if it's because I'm concerned that it may not be safe, if it's not effective, if I'm concerned about the speed in which it's been made, so that we know exactly how we should be targeting those messages and who we should be directing those messages to. And then it's one thing for me to talk about how I feel about the vaccine for it to be safe and effective, and then it's another thing for people who have a lot of credibility with the community to talk about it, right? So we've been working very closely with members of the faith community, with healthcare providers who are not only experts in infectious disease, but who are experts who are pediatricians, women's health providers, who specialize in HIV care and cancer care. So a lot of the individuals who really have high risk for severe illness if they are impacted by COVID-19. So really making sure that we are educating a lot of our healthcare professionals who are going to be on the front lines of providing this care, but also working very much with our faith-based organizations, our community healthcare organizations, our social support organizations who touch people in the community every day and are going to be the primary sources of information and the biggest trust brokers that we have for getting people interested in taking the vaccine.
Yes, Sam, did you get a question?
Yes, ma'am. What about salons?
We are making no change to salons. I think you know in the district, you're required to have an appointment for a salon, and their indoor capacity is limited by the number of operators in that facility. So that will remain. Yes.
Why were gyms closed altogether, like indoors, I mean? Was there a process?
Group exercises were closed.
Exercises limited or no longer allowed? Is there?
Sure, and I'm going to ask Dr. Nesbitt to speak to this, but I also want to say that we are going to have additional guidance about recreational sports activity, and that will be forthcoming. But what we wanted to get to today was just talking about the indoor classes, and we've also limited outdoor classes. But Dr. Nesbitt.
Sure. So we, as we were looking at a couple of things, so we look at data that we have, our epidemiological data that tells us about trends that we're seeing in our cases. So who's now being diagnosed, what age groups, what demographics are mostly impacted. in terms of their risk of transmitting, if they're asymptomatic at the time of diagnosis, et cetera, to help us create a picture. We also have another data set that we look at, and those are case investigations that help us understand what the risk for transmission of the virus was at that particular time. And then there's a third thing that we look at, which is the established public health literature, which are case studies, morbidity and mortality weekly reports, and that help inform us around the evolving public health science of COVID-19. And I guess I will also mention a fourth thing, and that's the evolving best practices. So when we are communicating with our peers in other jurisdictions, we are fortunate as the District of Columbia, as we fight for statehood. So we hope to only be in our state associations, but for now, we're also in city and county associations that help us get a lot of insight from our peers as to what's happening and leading to this surge in national cases, as the mayor mentioned. So when we look at all four of those things combined and really focusing, doing a hyper-local look here in the district, we recognize that there is an evolving reason why this 18 to 40-year-old group is right now driving our cases, but we need to be protecting against what eventually will occur is impacting the older population, which has a higher risk for more severe illness and a higher risk for hospitalizations, putting more stress on our healthcare system. I think many of you have noted that our hospitalizations have begun to increase. Even as we have an oscillation of hospital capacity, we do note that there is beginning to be an increase of the percentage of those patients who are COVID-19 patients. And so things like gyms, indoor gyms, which in the district, some of the gym operators have made some changes to their ventilation systems. They have made changes to their protocols, but large and in part, they have not all done that. And the utilizers of these gyms and having classes and shared equipment that may or may not be sanitized are often cited as some of the sources of transmission in our community, but also nationally. So when we have to start looking at what are the ways that we can tailor a response for rolling back some of the phase 2 activities, activities that were permitted first in phase 2 or initially in phase 1, to begin to get us some blunting of our curve, right? So reducing the rate of increase that we're experiencing, this becomes something that we can target and get us to where people can still frequent gyms, but not do so in a group setting, reduce the likelihood that you're having shared equipment that's not properly disinfected in between use, and then shifting activity outdoor as much as possible.
Yes.
So staying on gyms, so gyms in a condominium where just individuals are going, or a private gym where people are just going in and using a treadmill or just exercising individually, that is still allowed?
So as you can see here, it suspends, the mayor's order says that gyms, private trainers, and other businesses and recreation centers must suspend all indoor group exercise classes. So an individual going into a gym, an indoor gym, and using a treadmill individually is not prohibited.
Can I ask about any restrictions on hotels or conferences going to be in the mayor's order?
We already have those restrictions.
So there's no additional rollback there for hotels or?
Well, they're already pretty limited. I think Dr. Nesbitt will remind me, but I don't think any meetings over 25, so now that would be less, and nothing
Restricted to the
outside of the region. Yes.
Where is, well, we saw long lines this morning at some of the testing sites. Where are you all on capacity, and are you having to, stop those sites because you haven't reached max capacity yet?
I'm sorry, I didn't hear your question.
Long lines at testing sites, where are you all at capacity? Are you seeing you're having to close any of these sites early because you've reached max capacity on testing?
None of our sites have been closed early. Is that right, Chris?
So we haven't closed early. We are seeing the increase in testing, and we're paying attention to that to make sure that right now we're in the 3 to 5 day range to get results back to folks. We're averaging, I think, 4.6 was today on the average, and we want to make sure we stay that way. So we've opened up additional sites in the hopes that we won't have to cut sites off, but it also provides folks other places to go if one site does reach a capacity for the day.
Yes.
Are the feeding programs keeping up with the need at this point?
The
Yes,
meal
and we have-
sites, your question was about meal sites, Chris?
Yes, we haven't, we did a transition a couple of weeks ago from a lot of sites being provided by district employees to the community sites on that big long list of about 80, I think it was 76 community providers, and we haven't had a report of any issues so far.
So it's adequate, people are getting food.
Yes.
All right, last round. Any other questions? Yes?
Dr. Nesbitt, can I ask about the app on our phones that is tracking us? Have you been
It's
sending?
not tracking you. I have to interrupt you before
Sorry
you
about
even
that.
finish the question. Thank you very much. It does not track you.
That's really important, thank you.
Yes.
But I see great numbers in people who have turned it on. Have you been using it and sending out alerts, and can you tell us how that process is going?
Yes, so last week we had over 200 positive cases who during their interview reported that they had downloaded the app and were given a code to release notifications to their positive contacts. So that was as of last week.
And are you hearing from people who got that notification on their phone and what actions they took once they got it?
So I'm still waiting on analytics for that part. Yeah.
Yes.
Mayor Bowser, Thursday, obviously Thanksgiving, but also would have been the annual Turkey Bowl, which, as you know, is a rich DC tradition. It won't be played, obviously. What is your word to particularly high school seniors who look forward to this game? It's important for them, headed to college, and it's just one of the sacrifices I know everybody's being asked to make. But what do you say to these families who normally would have gathered at Eastern High School on Thursday for this DC tradition?
Well, certainly, my concern for the children missing school is manyfold. And you mentioned one of the traditions and extracurricular activities and sporting activities that are important to a child's high school experience. So not only are we working very hard to get children in-person learning, but part of that experience is they will have access to their sports and their friends and their coaches. And so all of that will be missed. And I know that you are a great friend and fan of the Turkey Bowl, as we are, and we look forward to having it next year. Yes.
I'd like to ask a different topic. This is in regards to the 911 call recording that was released via FOIA, and this is involving a dispatcher dispatching emergency crews to an incorrect address back in June. That event ended in the death of a 59-year-old mother in the district. I know you've been asked about these issues multiple times, especially by one of my colleagues right here in the past. This family did not get confirmation that there was an error here confirmed until this 911 call was released in the last week. In the 5 months that they've been waiting for official confirmation, why has the city not reached out to the family to confirm that there's a dispatcher error? And is there a failure of leadership here? Is that okay in your opinion?
Certainly, it's not okay if any of our systems failed, and we always thoroughly investigate any problem and make every effort to fix it and to fix it immediately. Yes.
Follow up on that. Have you listened to that 911 call yourself, Mayor?
I'm not sure. I may have.
Something you would remember. It's pretty heart-wrenching as the daughter is performing CPR. Is there an investigation? Is there an internal investigation into this Oglethorpe incident, and if so, will the results of that be made public?
I have to get back to you on that, Mark.
Are you concerned about, I know, as again, we've asked kind of the holistic question about 911, but on this very specific case, which is catching a lot of attention.
Like I said, I have to get back to you on it. I can't make a statement on it right now.
Mayor Bowser, what about the reporting overall, the fact that 5 months and no one from the city, not OUC, not Councilmember Allen, not your office has reached out to this family?
I don't have anything else to say about it right now. And I will, but I'm not prepared to talk about it now.
Do you have any update on the firefighter who was shot?
The firefighter that you referred to, and very unfortunate incident in our city where a firefighter was responding to a shooting victim and was himself, or was shot. And he was released, as I understand it, last evening. Okay, thank you.